Hi, this is the treatment diagnosis group for disinhibited social engagement disorder. My name is Dr. Casey Dahl and my client's name is Danny Olson. The differential diagnosis for my client is disinhibited social engagement disorder, and it was completely ruled in. The primary diagnostic features for this diagnosis are that the client experiences negligent care, deprivation of needs, or repeated changes in primary caregivers that result in disinhibited interactions involving overly familiar behaviors or lack of discrimination regarding social safety. My client's story is that he is a 5-year-old little boy, and his mother was a 16 and pregnant young girl who chose that her social obligations and her social life were more important than raising the kid that she was having. And her mother, client's grandmother, wanted her daughter to get an abortion. So when Danny was born, the mom dropped him off with grandma, and grandma didn't really care too much to pay attention to him. A couple years in, mom went on a road trip where she never came back, and then grandma was diagnosed with cancer and died 2 years later, leaving Danny completely neglected throughout that time and switching between his caregivers. Then the aunt swooped in and took Danny and was very excited to take Danny, and was amazed at how loving and outgoing and friendly that he was. And then she started noticing that Danny was very loving and friendly to everyone, including strangers and people he didn't know. He would climb on people's laps, and he would disappear in the mall and not look around to see where his aunt was. He was very clingy, and he is doing this behavior because he's never felt love before. So the aunt's very concerned that something bad will end up happening to Danny, that one of these strangers will take advantage of him, or that he'll get lost. And so she wants to fix this behavior that he's showing as fast as possible for Danny's own safety. So the multi-axial diagnosis says that axis 1 is disinhibited social engagement disorder. Axis 2 is none. Axis 3 is none. And axis 4 is negligent parenting and changes in caregiver. And axis 5 says that the GAF is 65. The theoretical perspectives I have for this client are the family perspective, which states that the family's symptoms could be the result of a negligent caregiving from the client's family. According to the structural approach, the client was neglected by the teenage mother, and his grandmother didn't care for him very well when he was in her care. When the grandmother became ill, she neglected him. This could be the reason the client does not have boundaries when it comes to strangers. The client's symptoms could also be due to the behavioral perspective. The client's symptoms could be due to a faulty learning experience caused by operant conditioning. The client was neglected as a child and now wants to be touched and talked to by people because it feels good to not be neglected, and this positively reinforces the inappropriate behavior the child is demonstrating. And that's all I have.